Did you know that every year 19 million cases of STIs are reported in the US, and 1 in 2 sexually active individuals will have an STI by age 25? The problem is that many STIs are asymptomatic, meaning you may not even know if you're infected. Remember that deciding to become sexually active can result in STIs and pregnancy, even when you have safe sex. The only way to 100% prevent pregnancy and STIs is to abstain from sex altogether. The good news is that there are methods of safe sex, and if you do contract an STI, all STIs are treatable and some are even curable. If you do decide to become sexually active, be responsible and get yourself tested. So, just what are some of these STIs, and how can you reduce the risk of contracting one or becoming pregnant? HPV is a viral infection which can affect the anus, genitals, or throat and is contracted through oral, anal, or vaginal sex, or even skin-to-skin sexual contact. More than 50% of sexually active people will contract HPV at some point during their life. There are over 40 different strains of HPV, some of which cause warts and cancer. Most infected people are asymptomatic. Cancer-causing strains do not show any symptoms until the cancer is advanced, so it is extremely important to get tested for HPV. HPV is a viral infection and therefore it cannot be cured, however, it is treatable. For instance, genital warts can be frozen off, removed, or treated with topical medication. If left untreated, cancer-causing strains can cause cervical and other less common types of cancer if the infection lasts for years. These cancers can lead to death if not treated early on. Also, babies born to women with genital warts can develop warts in their throats. The best way to prevent HPV as a female is to get screened, also commonly called a Pap test or Pap smear. A Pap smear is a microscopic exam of cells taken from the uterine cervix. Cervical cancer is much rarer in women who get screened regularly.
HIV stands for Human Immunodeficiency Virus. This sexually transmitted disease causes AIDS, also known as Acquired Immunodeficiency Syndrome. This is the most advanced stage of HIV. Every year, 56,000 people become infected with HIV. There are already 1.1 million people who have contracted HIV and are living with the adverse consequences of this disease. HIV is spread through oral, vaginal, and anal sex. A person may also become infected by HIV if they come in contact with contaminated needles or drug works. It can also be passed to children from their mother during childbirth, as well as through breastfeeding. Individuals who are infected with HIV are not known to experience any direct symptoms and often feel quite normal. It is only when the disease has progressed to severely attack the immune system where symptoms associated with other infections and cancers become apparent. There is no cure for HIV and AIDS. Antiretroviral treatment is commonly promoted to prevent the STI from spreading and growing stronger in the infected individual. This treatment attempts to slow the advancement of HIV and delay AIDS.
Chlamydia is a bacterial infection of the genitals, anus, or throat. It is the most commonly reported STD in the US, with over 1 million cases reported each year. The highest proportion of cases is among women aged 15 to 24. Usually, there are no symptoms. For women who do experience symptoms, they may have vaginal discharge that is discolored or a yellow-green color, bleeding while not on their period, and/or a burning pain during urination. Men may have a discharge or pain during urination and/or a burning or itching around the opening of their penis. Chlamydia can be passed through vaginal, oral, or anal sex. It can also be passed on from mother to child during childbirth. Oral antibiotics can be used to cure the infection, but both partners have to be treated at the same time to prevent passing the infection back and forth, and both partners should abstain until the infection is gone. If someone has chlamydia, they should be tested for other STDs.
%80 of unmarried teen mothers end up on welfare. Within the first year of becoming teen mothers, 1/2 of unmarried teen mothers will go on welfare. The daughters of teen mothers are 22% more likely than their peers to become teen mothers. Sons of teenage mothers have a 13% greater chance of ending up in prison as compared to their peers. Pregnancy is not an easy lifestyle. 1 in 3 women become pregnant at least once before age 20. Only 1/3 of teen moms earn their high school diploma. Only 1.5% have a college degree by age 30. Teen pregnancy costs the U.S. $9 billion annually.
No, I don't think you can tell if someone has an STI by looking at it.
Yes. I think it's natural. I think hormones are raging, and you have your own personal pressure because your hormones are raging, and you want to see what it's all about. And then there's also a cultural. There's sex all over the place in advertising, TV, and movies, and I think there's tremendous peer pressure and societal pressure to find out what it's all about and to be engaged. And if you look at the way that especially women are portrayed as how they should dress, I mean, we've got the Victoria's Secret shop right downtown Fairfield, and that's all about sex and sex appeal. So yes, I think there's a lot of pressure, both for boys and girls to engage.
Can I name them? Herpes, gonorrhea, syphilis. These are old ones. I'm sure there are new ones.
Those are 3.
Okay, those are the only 3?
There are more.
Oh, those I don't know. Well, not having any human contact is one way. Not having some human contact is another way. And I think that, I don't think that there are any, I think I used to think that there was now a vaccination, but I don't think for, at least the ones that I mentioned, there's no vaccination that I know of. So.
There is the condom.
There is the condom, yes. Thank you. That'll do it.
Okay.
Condom will do it. Thousands of cases of STIs would be reported, I would imagine. Millions? Really? Millions of people?
19 million.
Then, I guess
are
AIDS
reported
is
a year,
also
including AIDS.
AIDS. Yes. Well, then that would be a lot more.
In addition to contracting...
I was thinking Fairfield. What do students risk? Well, pregnancy would be one. Even if you're a guy, your responsibility, you have responsibility, so you definitely risk pregnancy. Well, for one thing, to take care of yourself, and then the other thing is to be responsible for not spreading it. Because if you don't get tested, then you can be sharing. That's how these things spread, really. I don't think that anybody says, okay, I'm going to now share this terrible thing with you. They don't know.
And a lot of these, so you wouldn't know.
Right, so you're asymptomatic and you wouldn't know unless you were tested. So you'd want to get tested for yourself and for those you love.
Let me think about that for a second. I'm not really sure.
No. No?
Are we supposed to know the answer? Where
It
5?
could break from the friction. Absolutely not. Absolutely not. Yeah, I'm gonna have to look into that.
STDs.
Do you know which
STI.
Herpes. No. Syphilis? It's not syphilis. HPV.